Hello everyone, welcome back to my YouTube channel. And today in this video I'll be covering about the topic safety net. And the topic goes like this: PBS and Medicare safety net, a practical dispensing and counseling guide for pharmacy teams. If you are new to my channel, my name is Sandesh. I'm the pharmacist over here in South Australia, and I usually make a video content for the educational purpose. For today's topic, I have made a PowerPoint presentation, so I'll be presenting that to you. And if you have any queries or any question regarding the presentation, you can leave a comment down below, and when I got the chance, I will be replying to that one. Okay, and stay till the end of the video. This video might be helpful for you if you are the uni student, if you work in the pharmacy setting, if you are a pharmacist yourself, and if you are a pharmacy intern, this might be helpful for you. Okay, so if you like my video, just hit a like button, hit a subscribe button, and the bell icon too, so that you will be notified when I upload a new video. The topic is PBS and Medicare Safety Net, a practical dispensing and counseling guide for pharmacy teams. I'll be presenting on this topic, and the topic is basically focusing on the safety net. What is the safety net and what thing to be looking after for the safety net, what is the threshold, and all the criteria for the safety net. Over here I have covered a PBS safety net, Medicare safety net, pharmacy role. Okay, and I will be mainly focusing on the PBS safety net and the pharmacy role rather than the Medicare safety nets. It is not that much important, so I won't be focusing on that topic. About the learning objective, I will be explaining the difference between PBS safety net and the Medicare safety net. I will explain about how to recognize and what is the role of Medicare concession and PBS safety net cards, and about the co-payment safety net threshold, and about the brand premium, and will it be included in the safety net, all those things. Okay, and I will be also giving the a point for the counseling in the dispensing counter while encountering those things. Okay, and the main big difference between the PBS safety net and the Medicare safety net is if you think of the PBS safety net, it is basically related to the PBS prescription. Whereabout Medicare safety net it is basically out of hospital Medicare services. It is not basically the PBS prescription cost, nothing like that one. Okay, in every year with the PBS safety net there is a threshold, and the threshold will be changing every year. With this 2026 year, for the general patient, general means who don't have the concession card, just a Medicare card holder patient, it will be $1,748.20, whereas for the concessional card holder it will be $277.20. In after threshold, like PBS medicine at the concessional rate, like after they have reached the threshold, for all the concessional card holder, all the medication that is covered by the PBS will be free for them for the rest of the year. For example, if they have reached the limit of $277.20 in February or March, and after the March till the end of the December, the medication that is covered by the PBS or pharmaceutical benefit scheme will be $0 for them if they do not choose a premium brand, if they go with the generic one. Okay, I'll explain about that one later too. And for the general patient, like if they have reached their threshold, the threshold is $1,748.20. If they reach that one by the within the mid or start of the year, it is hard to reach in the start. Most likely, let me give the example in the October, then rest of the year, October, November, December, end of the December, like tentatively 2 months, the medication will be on the concessional price. Now it won't be free for the general patient, but it will decrease to the concessional price. Okay, but for the concessional it will be zero. And for the Medicare safety net, as I mentioned, it is not anything related to the prescription medication or the PBS, anything like that one. It is basically out of out of hospital Medicare services, and it is basically not PBS prescription cost. Okay, and they have the different threshold, so I won't be touching that topic because it is not that important. Okay, basically, but you need to know the difference, like there is a huge difference between these two terms. Okay, in going back to the cost, 2026 PBS cost at the pharmacy. Okay, that means it is the cost that will be charged by the pharmacy, each pharmacy, on this 2026 year. Okay, for the general patient, maximum PBS co-payment will be $25. That means whatever the cost of the medication, for example, if it is a private prescription or private price was like $90, then it the rest of the price will be covered by the government, so you will be just paying $25. Okay, previously in 2025 it was $31.60. Whatever the cost will be, you will be just paying one amount, that is $25. Okay, and it is basically for the PBS, and it is just for the general patient, whereas for the concessional patient, they will be just paying $7.70, and most of the pharmacy will be giving the discount, and most of the pharmacy will be just charging $7.10. It depends upon the pharmacy rule. Okay, and with the PBS safety net, as I have already mentioned, it is till the end of the calendar year, so end of the December. So with the general there is the amount, and with the concession there is that amount. Okay, and yeah, there is an important note: if a Medicare had a brand premium or special patient contribution, that amount can still apply and does not simply disappear when the safety net threshold is reached. That means I'll show you the example of that one. Let me show you example of that one. Okay, we'll go back to that topic once again, but the example is something like this one. Okay, for that note, like for example, the PBS co-payment after safety net is $7.70, and the brand premium is $12. That means the brand that is they want, if the brand is charging $12, patient may still pay $7.70 and $12. That means $19.70 need to be paid by the patient instead of $7.70, because there is a charge for the brand they are taking. Okay, and the brand premium is not counted towards the PBS safety net threshold, so it won't be, this $12 won't be counted towards $277. So they will be just counted at $7.70 for the threshold. Okay, we'll go back once again to that topic. Okay, in card recognition and demonstration only. Okay, Medicare card, patient family consistent healthcare card, and PBS safety net card. Okay, you all know about the Medicare card. Medicare card are of a different type, like Antharam card and the normal card, like. And with the Medicare card also, as I mentioned, there is a threshold for that one, and all the family member will be included on that one. And with the concessional card, there is the eligibility indicator, like all the people won't be getting the concession card. It is depend upon the certain criteria. They need to fulfill that criteria to get a concessional card. And whereas PBS safety net card is the card that is issued by the pharmacy once they reach the threshold. Okay, and okay, patient journey prescription safety net. Okay, I'll show you the journey how there is the safety net. Okay, at first, prescription PBS listed medication is prescribed. For example, one of the medication is prescribed. Okay, and they come in the pharmacy. We check for the eligibility, check Medicare concession status. For example, amoxicillin is prescribed for one of the patient. Okay, they come with the prescription of amoxicillin 500 milligram, one capsule 3 times a day. Okay, and it was the PBS prescription. Okay, then we will be checking if they have the safety net, they have the Medicare details. If it is not highlighted over there, we will be checking that one. We will be checking whether the prescription is PBS or non-PBS. If it is clearly mentioned non-PBS, we won't be giving on the PBS price. Okay, and with that one eligibility, once we know that they have the concession, then we will apply that details in the system, and dispensing system will give the price. It will be $7.70, and some pharmacy will charge $7.10, giving the further discount. Okay, and after that is dispensed, it will be recorded. Okay, and like that, once they reach the threshold, we will be letting them know. Okay, but there is few details you can't miss, you shouldn't miss. Okay, for example, if they have the concession card, always check for the concession card, because there is high chances they will be reaching the safety net too soon rather than the general patient. Okay, because due to the safety net threshold. And second thing is like check if they have the same concession card with the family member included on that or not. Most of the family member will be included. There is a criteria for the children too. They need to be under, I think, 18 years and should be going to the uni or something like that one. I need to double check that one. Yeah, there is a criteria. They need to fulfill the criteria to aid as a dependent. Okay, dependent children. And once they reach the safety threshold, and after that only the medication will be free. This is the chart. How does it works? Okay, and there is the example of the family example. I have already explained about that one. Like parent A, B and child, each family member has the PBS prescription during 2026. Their eligible PBS patient costs are recorded towards the family's annual PBS safety net threshold. As I mentioned, they all will be added. Okay, and same goes for the general patient, general family example. 1650 accumulated, remaining of 48.209 and 98.20 is remaining. Staff can encourage the patient to ask the pharmacy to check the PBS safety net record. Okay, that means, like for example, if the patient go to the different pharmacy, we encourage them. Sometimes we ask them, do you go to other pharmacies, so that they can get the safety, we call it the PRF, prescription record form. They will bring that one so that we can add on our system. Okay, so because it will accumulate all the dispensing thing. For example, someone has for example, someone is on concession, they need to reach 277. Okay, but someone 277.20, and someone has spent around $78 in other pharmacy, and they have already reached $200. Then they can bring the safety net PRF, we can add in our system, and after that they will reach the safety net. So it doesn't matter they go to the different pharmacy, until and unless they bring the safety net PRF, it should be fine. Okay, and after threshold, once the family reaches the applicable threshold, general concession PBS rate for the rest, as I have already explained, if they are on the general just with the Medicare card, if they have reached the safety net, the price won't be zero for them, it will be $7.70, which is the concessional price. Okay, for the concessional it will be zero for the rest of the year. Okay, and about the brand premium, I have already explained about this one. Like still they need to pay the premium charge, and premium charge won't be added towards the safety net. Okay, okay, yeah, there is a counseling approach. We can check, like we can let them know that there is other brand, generic brand, if they want to stick with the previous like non-generic brand, or if there is generic one, we can explain there is a generic brand which is like if they are clinically interchangeable, you can let them know. But some of the medication, they are not clinically interchangeable. For example, warfarin with cowdamine, can't be Marivin with the cowdamine can't be interchangeable. Okay, and there is like eutroxic with iltroxin can't be interchangeable. Yeah, there are some of the medication that can be interchangeable. They are not clinically interchangeable. You can't change that one. Otherwise you can let them know that if they, for example, with the atorvastatin, there are many Sandoz brand, APO brand, and ARX brand, different brand. For the atorvastatin, those are the generic one, and there is a non-generic Lipitor. You can let them know that if there is a difference in the price, you can let them know that. Still, if they reach the safety net too, instead of being free, they need to pay the premium charge. Like here you can see brand premium charge. For example, there is a difference of $12 and the brand is charging $12. Yeah, they need to pay $12, but $770 will be zero. Okay, 60 days prescription and safety net. What to explain? Eligible 60 days prescription can reduce the number of pharmacy visit and may reduce annual prescription speeding. Because the patient spend less per calendar period, they may reach the previous safety net later than they would with monthly prescription. Okay, yeah. With this one, nowadays the doctor can write the 60 days prescription. Okay, for example, if they, let me go with the statin, like rosuvastatin. Doctor has written rosuvastatin 10 milligram once daily, and instead of quantity of 30 they write like 60. Then the medication will last for 2 months. Okay, and if there, for all the medication it won't be like that, but most of the medication, like the price, combining two price will be just $7.70. Okay, so in that case it will take time to reach the safety net, because previously if you see, like every month it will be $7.70 accumulated for one medication, but now it is for the two medication it will be accumulated just one price. But it doesn't apply with all the medication. I'm not quite sure with the rosuvastatin too, but yeah, it applies with most of them. And yeah, and at the counter, confirm the prescription quantity, eligibility, explain the cost for the 60-day supply, avoid assuming the patient will reach the safety net at the same time as before. Yeah, due to the 60-day supply, there is a high chances they will reach the safety net later. Okay, and you can check the previous safety net record. Okay, yeah, and pharmacy counseling checklist. Confirm Medicare concessional eligibility in the dispensing system. It will be shown over there. Explain the current PBS co-payment, $25 general or $770 concessional. This is for 2026. And you can explain about the brand premium, and you can check the PBS safety net tracking, and you can add the family if they haven't added. Okay, and you can explain about the Medicare safety net, and difference between the Medicare safety net and Medicare. Okay, there is the quick knowledge check. Okay, you can check what is the 2026 previous safety net threshold for the general patient. I have already covered about that one. It's $1,748.20. What is the 2026 previous safety net threshold for concessional card holder? It is $277.20. And does a brand premium count towards the safety net threshold? No. Is Medicare safety net the same as the PBS safety net? No. And what is the 2026 PBS general PBS co-payment? It is $25. Previously it was $31.50, I think. Yeah, 31 something. Okay, key takeaway. What have we learned today? Okay, it's a PBS safety net. It's called to PBS prescription medication spending. Medicare safety net eligible out of hospital Medicare services. I haven't covered much of that one because it is not that important. And 2026 PBS co-payment, general and concessional, safety net threshold, and brand premium can still apply after reaching the PBS safety net. Check the patient's actual eligibility and dispensing record rather than relying on assumptions. Okay, there is the quick references. If you need from where I got all the information, you can go through that one. and thank you so much. Thank you for staying till the end of the presentation, and if you like the presentation you can share this presentation with your colleague, and see you on next video. Thank you so much.